So most families, when they're planning for retirement, they're thinking carefully about the stock market. They're thinking about taxes. They might even be thinking about Social Security and how long that money needs to last. But I'd argue there's a risk that almost never makes it on the list. And when it arrives without a plan, it can do more damage than a bad market year. My name is Matt Landon. This is Money and Meaning. In this little sequence here, this little episode, I want to talk about long-term care, what it actually costs, why most people are unprepared for it, and what the planning options look like before the need arrives. This isn't a comfortable topic, and I want to hit that head on because this is something that when you're dealing with it with a family member, it's deeply personal, it's very challenging, and when you're considering it for yourself, it can be very uncomfortable to think about. So that's one of the reasons that I believe it's a consistent gap that we see in retirement plans. The other reason is that when you don't have a strong understanding of something, it's easy to kind of say, this is confusing. It scares me. I want to put it to the side. So I want to address some of those concerns and just take it head on today. Right off the bat, a lot of people assume that Medicare is going to cover long-term care. It doesn't. Medicare covers short-term skilled nursing care, and that's after a qualified hospital stay. And even then, it's only under specific conditions and it's only for a limited time. And after that, the cost goes directly to the family. So what does it actually cost? Assisted living, it's going to run anywhere from $6,000, $8,000 a month on up, and it can continue to climb depending on the kind of care that's needed. A private room in a nursing home, that can exceed $10,000 a month. The average care of like the time needed is usually between 2 and 3 years. Of course, there's outliers. Some folks are much shorter, some folks are much longer. But because 1 in 5 are going to need care for 5 years or more. So when you do that math, you're looking at a potential 6 or 7 figure expense. And that's one that arrives in the middle of retirement. It comes with no warning and no reason to delay. This is not a healthcare expense. This is a wealth event. So for a lot of couples, that is a second dimension that people miss. An unplanned care event, it doesn't just affect the person that needs it. It can quietly drain the savings of the other spouse who is counting on that money to live off of for the next 10, 15, 20, 30 years. So we've worked with families where one long-term care event, it ended up restructuring an entire estate plan. Not because the money wasn't there, but because no one had thought about where it was going to come from or how it was going to come. So here's the thing with long-term care planning. The options available to you, they depend almost entirely on when you start looking. Long-term care insurance is medically underwritten. You have to qualify, and qualifying gets harder as you get older or you have any kind of health issues develop. Now, that's not a reason to panic, but it is a reason to look at it sooner. Now, the other thing you want to keep in mind is traditional long-term care policies have become harder to find. Most insurers have exited, or many of them rather, have exited the market over the past decade. There are a lot of hybrid policies. These are things like life insurance policies that have a long-term care benefit. And that, in my opinion, is a more practical opinion for a lot of families. You get a death benefit if there's no long-term care that's needed, and you have a long-term care benefit if you do have a need. For the right family, that can be a meaningful piece of the plan. I personally don't like anything where you throw money at it and you don't get anything back. I figure if I'm going to put money into something, I want to know I'm getting something back out of it, either with long-term care or with a death benefit. Now, another way of addressing this is self-insurance. You can set aside a dedicated pool of assets and just kind of earmark it for long-term care. This can work great for families with significant savings, but it has to be intentional. And it's not the same as assuming the money's going to be there. This really means identifying specific assets, understanding how they would be drawn down, and making sure that drawdown doesn't compromise the rest of the plan. And when I say compromise the rest of the plan, I mean both from a cash flow standpoint for income for the surviving spouse, but also from a tax standpoint. Now, what a lot of families do is they end up with some kind of combination. You get some partial coverage through a policy, you get it partially through a dedicated asset pool, and there's a clear sequence for what gets used first. So the conversation you should have with your advisor isn't about what's best in theory, it's about which option that is best for your health, your assets, your family structure, and the risk you're actually willing to take. You could do what I did. I married a cardiac ICU nurse. There's my long-term care plan. Well, I say that kind of flippantly because, yeah, that's a great plan for me, provided she's there. But who's going to take care of my wife? And I think sometimes when we talk about long-term care planning, I have a lot of people that say, well, we're just going to take care of each other. And that's great as long as you're both healthy or one of you is healthy and able to take care of the other one. But who's going to take care of that surviving spouse? Some folks, their kids are saying, I'll jump in. Other folks, they may not have kids or their kids are across the country or not in a position where they can help. The whole point of planning here is to say this isn't a comfortable topic, but it is an important topic. And the Medicaid spend down, there's a couple issues I have there. One is around the effect that it can have on the surviving spouse. The second is the fact that it can absolutely destroy that estate. If you wanted to leave a legacy to others, that's going to erode it. And then the third thing is when you're relying on Medicaid for long term care, you're staying in a facility that, frankly, the employees may be doing their best, the staff might be trying their best, but there are a lot of restrictions. And when there's not a strong cash flow, that's probably not a place I would want my family to be in. And you're likely in a similar situation. So I would say the first thing to do here is to understand nothing guaranteed, but also you want to take the time to look into this because the confidence that you can have when something hard does happen. The people that you love aren't left trying to figure it out from scratch. I think that's invaluable and incredibly, incredibly worth your time. Thanks for listening to Money and Meaning. I hope this has shed a little bit of light. If you have more questions, you're welcome to reach out. Someone from our staff or myself would be glad to talk with you about it. My name is Matt Landon. Thanks for listening. I'll see you next time. Have a wonderful day.